In health lesson, you are expected to explain or discuss the proper health appraisal procedures and its importance to achieving holistic health. Knowing these procedures can prepare you in assessing your health and somehow prevent more serious diseases in the future. Answer the following questions. Write your answer sa chat box. So, antayin nyo yung go signal ko bago nyo ilagay yung sagot nyo dyan sa chat box natin. First question. Do you go with your parents to visit your doctor in private or sa barangay health center? Type yes or no sa chat box. So, kayo ba ay nagpapa-check up o hindi? Yes or no lang sa chat box. Tingnan ko nga kung sino-sino yung nagpapa-check up dati. Next question. Can you identify the different medical tests that you had since you were in elementary grade? So, meron bang ginawa sa inyong medical examination or physical examination ng doktor? So, ano-ano yung mga exams na yon? So, all answers will be accepted. Type your answer sa chat box. Tignan nga natin sino-sino yung mga nagpa-participate. Health appraisal. It is a series of medical procedures to determine the health status of a child through health histories, teacher or nurse observations, and different screening tests like medical tests, dental exams, or psychological examination. What are the different screening tests? Weight taking. It is a process which you will do to be aware of your weight. Weight is defined as the heaviness or lightness of a person and may mean the weight of a person's body. Weighing beyond the normal weight may mean that the child is overnourished, which may also affect the child's health. It is important to get an accurate weight of growing up teens to assess whether a child is growing well or growing thin due to malnutrition or other factors. So, ano yung kailangan natin para makuha natin yung tamang timbang? Siyempre, kailangan natin ng weighing scale, pen and paper for recording. Procedure: wear a light clothing before weighing. On bare feet, stand on the weighing scale and keep still. The weight must be evenly distributed on the center of the scale. Record the result of your weight in kilograms. Reminders: before stepping into the weighing scale, check the dial lever if it is at 0. Take turns in weighing and recording. Height taking. It is a process which you intend to measure your height. Height is a measurement from base to the top or from feet to head of the standing person. It is the distance between the feet on the floor to the top of the person's head. Height measurement can be done individually or with a partner for more accurate results. A tape measure, ruler or book, and pencil are used to measure a person's height. It is also best to perform the said activity with your back against a flat wall. A medical equipment that gives a more accurate measure of your height is called stadiometer. Medical examination or physical examination is a routine test wherein the pediatrician or a family doctor may feel or listen to the different parts of the person's body to keep track of changes in one's physical health, check for medical conditions or possible diseases, and or determine whether further tests are required. The doctor may also ask about other medical complaints that a patient may have experienced prior to the visit. After examining the patients, a doctor may give vitamins as supplement or advise other tests to ensure the patient's optimum health and well-being. Breast self-examination, or regularly examining your breast on your own, can help adolescents check any irregularities that might need medical attention in the future. It can be an important way to find a breast cancer early. What are you going to do if you find a lump on your breast? Do not panic if you think you feel a lump in your breast. Do not hesitate to call your doctor if you have noticed a lump or other breast change that is new or worrisome. This is especially true for changes that last more than one full menstrual cycle or seem to get better or more prominent in some way. Develop the habit of doing breast self-examination monthly. It is advised that since there are normal changes that occur during or before menstruation, perform the breast self-examination preferably right after menstruation. Follow the procedures written on your module to self-examine your breast.
Here is how you can conduct breast self-examination, or BSE in short. If you're menstruating, do the BSE 7 to 10 days after the start of your menstruation. It's simple. Just give your breast some TLC. Touch, look, check. Begin by lying on your back. Place your right hand behind your head. With the pads of the middle index and ring fingers of your left hand, gently yet firmly press down using small motions to examine the entire right breast. Use any of the following patterns you're most comfortable with to ensure you've covered all of the breast tissue. Next, sit or stand and feel your armpit because breast tissue extends to that area. Gently squeeze the nipple, checking for discharge. Repeat the process on the left breast. Now, stand in front of the mirror with your arms by your side. Look at your breasts directly and in the mirror. Look out for the signs of breast cancers, which include 1. A painless lump in the breast or armpit. 2. Rashes around the nipple. 3. Discharge from the nipple. 4. Changes in the skin over the breast or nipple. 5. Retraction or pulling in of the nipple.
Scoliosis. It is a deformity of the spine, where the spine curves to the side, often with an S-shaped or C-shaped curve. It commonly occurs when the young teens experience a growth spurt just before puberty. However, the condition can appear at any age. Dr. Byron Garcia, a rehabilitation medicine specialist, adds that scoliosis is treatable. If identified earlier, the better. There are no data yet regarding scoliosis in the Philippines, according to DOH or Department of Health. But Dr. Oliveros, together with his team, and Amanda Bonife-Quiamco, a scoliosis awareness advocate who founded Scoliosis Philippines, are pushing for the children's initial screening for scoliosis in school to be mandatory from 6th grade to 8th grade.
You may be wondering how scoliosis is detected. Scoliosis can be detected a number of ways, but two of the most common are 1. At a consultation with your trusted care provider, or 2. During a school screening. What are school screenings, you ask? School screenings are conducted at your school and performed by a school nurse, athletic coach, or PE teacher. School screenings may take place at different times for boys and girls. Because boys and girls generally mature at a different rate and different ages, Girls are typically evaluated in 5th or 6th grade, and boys in 6th or 7th grade. School screenings are state mandated. Check with your school to see if they offer scoliosis screenings. Several things to look for when screening for scoliosis include: 1. Head appears off-centered between the hips. 2. One shoulder appears higher than the other. 3. One shoulder blade is more prominent than the other. 4. Trunk and rib cage appear shifted to one side. 5. Waist appears asymmetrical. 6. One hip appears lower than the other. And 7. Clothing hangs unevenly. One test your care provider may perform is called the Adams Forward Bend Test. As your spinal curve develops and the spine twists, asymmetry of the rib cage or waist is created. A scoliometer is used to measure the amount of rotation. Trunk rotation is determined with a forward bend at the waist and is a reflection of the severity of scoliosis. A rotation of greater than 5 to 7 degrees suggests scoliosis may be present. Okay, so after your care provider or school nurse identifies signs of scoliosis, what is the next step? At the time, you will most likely be referred to a scoliosis specialist to confirm you have scoliosis and analyze the severity of your spine's curve. A few things that may happen during your visit with a scoliosis specialist. 1. Review of the patient's health history and the family history are gathered. 2. The Adams Forward Bend Test. 3. X-rays of the spine are obtained confirming the sections of spine with abnormal curves. 4. In some cases, your specialist may order an MRI to examine your spinal cord. Finally, your specialist will begin discussing a recommended treatment plan with you. Scoliosis can be treated non-operatively or operatively, depending on how large the curve is. Non-operative treatments include: 1. Observation. 2. Bracing. And 3. Scoliosis-specific physical therapy. Operative treatment is surgical intervention and considered when the curve is significant or likely to progress after the patient has stopped growing.
Hearing test. It is a process to detecting one's hearing capability. It is necessary to allow children to go through audiology evaluation while growing up to avoid hearing loss. Loss of the ability to hear during childhood can be congenital, delayed onset, acquired, or progressive in nature. In some cases, a mild hearing loss cannot normally be identified through a routine hearing screening. An audiometer is used by an audiologist to determine a person's hearing sensitivity at different frequencies. Weber test or Rina test are examples of hearing test. Vision test. It checks different functions of the eye. This is usually done along with the examinations with complete apparatus and tests that check the health of the eye, such as phoropter or phoropter and Snellen chart. Dental checkup. Teenagers are advised to visit the dentist at least twice a year to prevent gingivitis, cavities, plaque buildup, and to take care of their pearly white teeth. The following may be examined during your visit to the dentist. Assess your overall oral health and hygiene. Assess your risk to tooth decay, root decay, and gum or bone diseases. Evaluate your need for tooth restoration or replacement. Remove stains or deposits on your teeth. Check your bite and jaw for problems. Dental or oral health must be maintained at its optimum to avoid damage to gums and teeth brought about by unhealthy eating habits such as eating junk foods and carbonated drinks. For your Check Your Understanding in Health essay writing, you're going to write at least or not less than 5 sentences and answer each item in paragraph form. Number 1. Why is it important to follow specific instructions in the conduct of appraisal test? Number 2. Explain this quotation. An ounce of prevention is better than a pound of cure.